Hello again, everyone, and welcome back to my channel. It is Dr. Cynthia here again. This is a channel all about lifestyle, health education, and every other thing under the sun. If you have not subscribed to my channel, please click down below, subscribe, and tell a friend to tell another friend. So today, what I want to talk about is racial inequalities in healthcare. Now, unless you've been living under a rock, you would know that over the last 2 weeks, we've had a lot of positive change, a lot of positive progress in relation to the Black Lives Matter movement. Now, this all stemmed from two incidents where an unarmed Black man was killed and murdered by a police officer, 4 police officers, by putting him in a chokehold for over 8 minutes. Now, this has led to a lot of conversations about Black people and the inequalities that we face in this world. I am a proud Black woman, and I am also a doctor, so I know that there are racial inequalities in healthcare and access to healthcare, and that's what I want to highlight today. Now, I'm going to give you a few facts, okay? Going to give you a few facts. So, few facts. Black women are 71% more likely to die from cervical cancer. Black women are 243% more likely to die from complications related to pregnancy and childbirth. As we all know, and COVID pandemic has highlighted this, Black people were more likely to die from COVID. Even when it was adjusted for age and other health conditions, Black people were still more likely to die from COVID-19. A study back in 2016 found that when admitted into hospital or when they visit their GP, Black people are less likely to receive pain medication. So Black people are more likely to be left in pain or their pain dismissed by a healthcare professional. Now, another study from 2016 found that healthcare workers still have these biases against Black people. This same paper found that for some reason, some healthcare professionals thought that Black people had thicker skin or skin that was different to white people, so we didn't need pain medication as much. And finally, 2 different papers have found that people who report exposure to racism, so people who have experienced racism, and let's be honest, the only people who have experienced this are Black people and people of other ethnic minorities. So people who have experienced racism are more likely to have physical conditions and mental health conditions. And another paper in 2006 found that people who are in ethnic minorities, so Black people, were more likely to be exposed to chronic and long-term health conditions. Now, the reason I wanted to talk about this topic is that it's something I'm very passionate about. Other than a doctor, I'm a Black woman. My family is Black. A lot of my friends are Black. So it hurts me to know that just because of the color of our skin, we are exposed and more likely to suffer inequalities when we access healthcare. Now, there are plenty of reasons for this. Number 1, there are socio-economic reasons. In the United States, the median income for a household, if they are Black, is $11,000, whereas for a white household, it's over $100,000. If you have less money, you are less likely to buy good food to look after yourself. You are less likely to buy the medication that you need if you live in a country like the US. In the UK, thankfully, we have the NHS. But again, this economic disparities between white people and Black people will lead to adverse outcomes in health. Another reason for this are cultural differences. So Black people are less likely to seek healthcare. Black people are less likely to seek help for mental health issues. It's a cultural thing, and that's something that we have to address within our communities. Another thing, it's biases in healthcare professionals, white and black alike. Now, like I mentioned earlier, there are some papers and some studies, they have found that for some reason, black people are less likely to receive pain medication. And this is due to the biases that healthcare professionals have against black people. For some reason, we have in our head that there are actual genetic differences between black people and white people. And so that changes the way that healthcare professionals like myself will treat black people. And this is something that we can definitely do something about. This is something that we can definitely do something about. The one thing that I would say is that all healthcare professionals, all hospitals, all trusts, all NHS trusts need to train their healthcare workers, their doctors and their nurses in tackling unconscious bias. Now, what unconscious bias is, it's that they're biases that we don't even know that we have. We can't address something if we don't know that we are doing it. So there has to be training. There has to be self-awareness that sometimes we have these biases. So this has to be tackled. This unconscious bias that healthcare professionals have has to be tackled. It has to be talked about. We have to have conversations about it, because if we sweep it under the rug, it's going to continue happening. The third thing that we can do to address these inequalities in healthcare is that there has to be education. It needs to start from the very beginning. It really does need to start from the very beginning. Now, when I was in medical school, every single condition that I was taught how to recognize in a white person. Let's take, for instance, cyanosis. What cyanosis is, it's people turning blue because of a lack of oxygen. Black people don't turn blue. We don't turn blue. So if a black person has no oxygen, how are you going to recognize it? We're not taught this in medical school. We're really not taught this in medical school. Let's take skin conditions. Okay, so I'm going to give you two examples. Let's talk about erythema multiforme. This is a skin condition. All the textbooks shows how it looks in a white person. Okay, so I'm going to show you how it looks. That's what we're taught in medical school. Now I'm going to show you what erythema multiforme looks like in a black person. They look very different. Now, I know what it looks like in a white person, but because I wasn't taught how to recognize it in a black person, I don't know what it looks like. Now, if God forbid I develop this skin condition, my dermatologist that has seen me may have no idea what they're dealing with, and that will lead to a later diagnosis for me. Now, let's take something else, jaundice. Jaundice is yellowing of the skin, and it can have many causes. For example, liver causes, pancreatic cancer, blood conditions, blood cancers. So jaundice is yellowing of the skin. If you are white, you are more likely to turn yellow. It will be obvious to your physician looking after you. A black person or someone who's my skin tone, a darker black person, I won't turn yellow. So a doctor might not be able to recognize this health condition in me or this symptom in me to lead to a diagnosis, putting my life at risk. So there has to be a change in education. Medical schools have to start teaching their students how to recognize health conditions in all races. White is not the standard. Okay, I'm going to say it again. White is not the standard. Every single person on earth has a right to good healthcare. Every single person has a right to walk into a hospital and not experience bias and not experience discrimination based on the color of their skin. Every single person has a right to life. So the one thing that I can say is that at the moment, whilst there is a shift, whilst conversations are happening, Black people, we need to fight for our health. If you feel like you are not being taken seriously by your doctor, speak up and fight for your health, okay? Until those changes happen, and that may take a few years. Until those changes happen, fight for your health, because right now the system is not designed to fight for your health. So we need to fight for our own health.